Welcome back to the TMDSAS podcast, where we'll explore the TMDSAS application in greater detail by connecting you, the applicant, with the admissions experts who are ready to help. I'm your host, Enrique Hasso, Coordinator of Research, Advising Services, and Digital Media at the Texas Health Education Service in the TMDSAS office in Austin, Texas. With me today is Dr. Mike Kennedy, the Director of Admissions and Outreach at the University of North Texas Health Science Center, Texas College of Osteopathic Medicine. Hi, Dr. Kennedy.
Hi, how are you?
Doing great. Thank you very much for joining us today.
Okay.
We got quite a few questions to get through, so we're just going to go ahead and dive right in. First off, we'd like to kind of share with all the applicants this year. Could you tell us a little bit about your academic background?
My bachelor's degree is in liberal arts from the University of Nevada, Las Vegas, and I have a master's degree in education from the University of South Carolina, and my doctorate of education is from the University of North Texas in Denton.
Wow, been all over the place then.
Yeah, a little bit all over.
Can you tell us a little bit about your experience in admissions?
Okay. Actually, my first admissions experience was when I was an undergraduate student. I got appointed to the admissions committee for my university. So that was kind of a fun experience. And I guess it's translated along where I eventually went into it full time after earning my master's degree. And this is now my 21st year.
Wow, congratulations.
Yeah, thank you.
Yeah.
21 years working either graduate admissions or professional school, where I've been at TCOM for the last 17 years.
Fantastic. Lots of consistency there.
Yeah.
We kind of want to address the elephant in the room. You are the Texas College of Osteopathic Medicine, TCOM, and a lot of our listeners want to know a little bit more about the difference that osteopathic medicine has when you're considering it against, the allopathic medicine track.
Okay. I'd like to, first to talk a little more about commonality. I think for the average pre-medical student who may not be familiar with osteopathic medicine, the easiest way to start with this is that DOs are physicians. So a DO is a neurologist, a pediatrician, a psychiatrist, a family medicine physician, an internist, a surgeon, emergency medicine doctor, any number of specialties out there. They're seen as the same thing. And for a lot of patients, they probably don't know there is a separate profession of osteopathic medicine or who is treating them for their medical care. But what makes us somewhat different, and being other than earning a degree and Doctor of Osteopathic Medicine degree, that we kind of subscribe to a different, what we call philosophy of medicine. And what I mean by that is that DOs in our training in the medical school here, that we train you to be much more of a health-centric approach. The common phrase is that we're treating the person, not just the symptoms. Right. And what we mean by that is that we want to train our future doctors here to focus on the health of our patients and the patients they're going to treat. And we spend more time on the social aspects of medicine. We'll probably spend more time about prevention than probably their allopathic counterparts. Not to say that they don't, but we tend to emphasize that more, in particular clinical courses, that our faculty who are working with students in sort of the day-to-day hands-on kind of practice of medicine where the rubber meets the road. The kinds of questions they're going to ask their patients when they're training. So usually when a DO student or a DO really kind of sees when that difference between these two professions comes about, usually is when after graduation, when they start working with their MD colleagues, and they're starting to discover that their approach seems to be trained a little bit differently. And not to say that's for every DO and it's the same for every MD. These are kind of the big general questions. I think that is probably the most easiest way to describe the difference. We also talk a lot about the musculoskeletal system, since the term osteopathic, that's where it comes from. Right. So we talk about it because it is, without a doubt, it is the largest portion of your body, and it's a conduit of your function and structure. So osteopathic medical students are taught to look at that big picture within your human body and how that integrates with your health. And so one of those fundamental principles, we keep your body working properly, you're healthy, you're better, you're going to be the outcome that you want, any doctor would want for their patients. That's what the philosophy we're subscribing to here at TCOM or any other DS school.
Mm-hmm. Well, fantastic. I think a couple of years ago, we actually had a conference over in Fort Worth, and we were able to meet with some of the students that are there at TCOM. And I think one of them really kind of hit it head on, and she addressed it as, it's another tool that I have in my toolkit.
Yeah, we do spend a lot of time about musculoskeletal medicine.
Mm-hmm.
And actually, it's interesting. There's two things about that. One, you start to learn a lot about applied anatomy. You're going to learn a lot about how the function of the body works. You're going to learn about physical pain, actually, for people who may have issues, which there are millions of people who suffer from musculoskeletal problems. Mm-hmm. That this is another tool in addition to maybe a prescription medication, which still DOs will use that as well. But the other part is a diagnostic tool that you learn a lot about the human anatomy. In ways you learn about your ability, your tactile function. You have a set of observation tools with your hands through musculoskeletal medicine, where you don't necessarily get that kind of practice somewhere else. And I think from that perspective, those two kinds of points of view really add to that. The benefits of what we call osteopathic manipulative medicine, or OMT. It's used in a number of tools. But in some form or another, actually, osteopathic principles in that regard have been around actually predate the profession of osteopathic medicine. And,
wow.
You can go back probably, over a millennia and discover some way or form people have been using these in different names or in different places. This profession has sort of formalized it more into the 20th century and now the 21st century.
Mm-hmm. Awesome. Well, thank you very much for addressing that. Could you tell us a little bit about kind of what the curriculum looks like at TCOM?
Well, I mean, it's a 4-year program. Traditionally, with a 2-year, what we call preclinical, and a 2-year clinical-driven process. The things that are changing in our curriculum is that we're moving away from we've moved away, and we're continuing to move away from what we call passive listening to active learning. Students are going to be really learning, acquiring information outside the classroom more. And what our expectation is, come to class prepared to actively engage in groups, discussing pathophysiology, patient care scenarios, differential diagnosis. This is the direction we're going to go into. So what our goal is that we really want to have at least the preclinical curriculum at the beginning to spend more time, more association with the actual practice of medicine. So we're going to talk about in the preclinical, we're going to use the context of patient cases much more. The first several months are still continue to be mostly associated with normal structure and function. Something that was a year is now about a little more than half a year, where you learn anatomy, physiology, an introduction to pathophysiology. And then the last part of our preclinical will be much more case presentations. This is what you'll see is actually in clinics as a 3rd and 4th year, as a physician, resident and a physician. People will come with the problems, and we're going to teach you how to differentiate, narrow down that focus, what was potentially the problem, underlying issue. For a medical student, that once you get past this part, and this is not easy, the treatment options, well, one, they reveal themselves, and right. The other part is that they'll be more effective. So if you make the wrong diagnosis, obviously, your treatment option may not be very effective. So that is how our curriculum is going to structure in the first couple of years. And then the 3rd and 4th year, we We have a wonderful hospital system that we've been working with around the state. Our primary teaching hospital is John Peter Smith Hospital here in Fort Worth. For those who don't know it, it's a over 550 bed county hospital with a level 1 trauma center, with a very robust psychiatric unit. It's the safety net hospital for a community of about 1.8 million people. So there's a lot of diversity in our patient population, lots of different kinds of cases that come in. We also partner a second hospital. We have several, but a second one is Cook Children's Hospital in Fort Worth as well. And it is a nationally known pediatric hospital. So they have been a wonderful training ground for our students in pediatrics. They actually partner with us in several student research programs to give students the opportunity to really engage in either eventually going into pediatrics or looking at even subspecialties in pediatrics. We also have partnered with the hospitals in Corpus Christi. For those of you that had an interest in going down to the Gulf of Mexico area, South Texas, we also partner in East Texas, Hospital Longview. So, and then there's some other opportunities as well that either are emerging or we're looking at. But most of our students are going to be in Dallas-Fort Worth in their clinical years. So certainly core rotations for us are obstetrics, gynecology, psychiatry, internal medicine, family medicine, surgery, any number of these. Emergency medicine is one of the last ones. We have core rotation geriatrics. We feel strongly that that you, as a future physician, you're going to work with a lot of the aging population, which is kind of emerging to be a healthcare issue, medical issue. To learn more about that, we also have another rotation called the Primary Care Partnership, and really that is really getting down to understanding primary care from the community level, and so getting into a smaller clinical setting opportunity. And then students have electives, and one of our emerging areas is international. We have students going to Malawi in Africa. We have students going to Thailand. We're looking to build some other programs. Some students have gone to Russia, so we've had students go to the Middle East. So we just had a few students in spring break come back from Guatemala. So they had a visit there for a week and to do some hands-on clinical with our physician faculty. So that's something a lot of people, I know a lot of prospective students are interested in knowing. Do EOs go overseas? Yeah, the answer is yes. That we're building a program that works in conjunction with our global medicine and also what we call our rural medicine program, which if you're interested in a rural program in terms of working a career in a small town, we have a great program in that as well, that we will get you connected with the small communities in the state of Texas, and you'll see the challenges of being a small town doctor. And one case is the flu, your next one, you're delivering a baby. And the next one, maybe you're an emergency medicine doctor now, or next one, you're going to be a psychiatrist. That you literally wearing the hats of an entire hospital into a small clinic.
Well, lots of great opportunities for the students at TCOM.
Yeah, I mean, we continue. We also are growing. One of the areas of growth has been student opportunities for research. Again, with the local children's hospital, we have a fairly large science faculty here that have summer research opportunities. So these are things that we offer a fairly large umbrella of things to do. And also, we're proud of our students working in community service. Literally thousands of hours of community services done every year from TCOM. We've had students serve on the Board of Regents for University of North Texas system repeatedly. Wow. We've had our students selected to the Higher Education Coordinating Board to serve there as student representatives. This week we have students going to Washington, D.C. To lobby Congress on behalf of interest for medical students. We had students go to the state capitol every session. So they're active. We look for that. We want our students to be active community change agents and think about that in their career. And as a physician, you do You're seen as a person of responsibility and learned person, a person that can shape opinions of others. And so we feel like being involved here on campus is only going to strengthen your desire to continue to carry that forward in your career.
Absolutely. All right. Well, let's go ahead and dig into our next question. Can you tell us a little bit about why you decided to come and work at TCOM?
Well, when I first came here, I was pretty excited about coming to Fort Worth. I had never been here before. Until I came to interview here, everybody that I met was just friendly. Actually, the same day was the beginning of what they call the Fort Worth Stock Show. For those of us those in Dallas, Fort Worth, that know about the stock show. But if you're coming in from Connecticut, you don't know about the stock show. And then you go see it, and then you're like, this is really a lot of people having a good time.
Right.
And seeing a lot of just interesting things. I knew that at that moment, I said, this is a community that's different than any other community I've been involved with or lived at. So I came and I was very excited about that. But what keeps me here is really there are just a lot of neat people here. This institution has grown a lot since I've been here. We probably had about a little over 1,000 when I showed up here. We're over 2,000.
Wow.
In the entire Health Science Center. And so from that, but a lot of people interact across campus. Mm-hmm. So that is really exciting. So and I've found out from people I know all over the country, and they'll say they never have that kind of interaction where I will meet with a biologist, somebody from anatomy or from immunology and internal medicine and pediatrics, and interact with them on a pretty consistent basis. And they know who I am, I know who they are. And that's been the whole time I've been here. That we're still being a small community. And the other thing is that there's always a strong desire for student success. And I think we have a bunch of, not just a lot of people here, but to get to know each other, but they're nice people. And there's a strong bent together to be a very service-oriented institution. Absolutely.
And Fort Worth itself has grown so much just in the past few years.
Yeah, it's not as big as it's grown as fast as Austin, but actually in the last census we were the fastest growing county in the country. Tarrant County.
It's getting there.
Yeah. So, but there's everything for somebody that wants to come here. And if you really, just a side note about this, I mean, I remember my interview here, and I remember actually making the remark, and people from Dallas Fort Worth know this, the rivalry between Dallas and Fort Worth.
Right.
and I remember making the remark saying, oh, well, if I really just need to get something, I'll just go over to Dallas. And the person interviewing me said, you don't need to go to Dallas. And I said, and he goes, everything you need, you won't even have to get to Dallas to get there. And I was like, okay. I just kind of took it in stride. And actually, I will tell you that, other than the times I go visit students at pre-meds, maybe at UTD or University of Dallas, or even University of Dallas is in Irving, and UTD's in Richardson, or, if I go, I'm going to SMU, and that'll be in Dallas. But I really don't go to Dallas very much. And they were actually right about that. And there are a few things I'll go to, but on a daily or weekly basis, or even a monthly basis, I never get that close to Dallas.
Right.
And nothing against Dallas, it's just there is a lot here, but the Metroplex is a very large place.
Absolutely.
But yeah, the Tarrant County area, it's got just about everything you need. But you always have access to things over in Dallas too, and people from Dallas come over to Fort Worth, and so our campus is in what we call the Arts District, the Cultural District of Fort Worth. There are art shows that come here that interestingly you'll see it are in LA, Chicago, New York, Fort Worth. Why Fort Worth? And Fort Worth does have a strong support of the arts community here from a lot of the city fathers, and they've continued to encourage that here. And it's interesting. We can go right across the street and see artworks for free that at lunchtime if we really wanted to.
Wow.
At a world-class museum. So, or there are art shows that come through all the time with really fascinating stuff.
That's great. All right. Well, we want to give each of the schools the opportunity to address one of the big issues or myths that you hear. A lot of times students talk to each other and they come up with their own admission strategies and their own policies. So we'd like to give you an opportunity to tackle one of those myths and do your own myth busting.
Okay. Well, I mean, I'm being the osteopathic school, I guess I need to certainly address the myth.
Right.
Well, the question, if I go to a DO school, what are my opportunities in my career? I think, first of all, you need to realize, even if you go to an allopathic or an MD school or a DO school, your career opportunities are what you're going to make of them. No matter what medical school you go to. Medical school, and we feel this way about us, we will give you those opportunities to mold yourself towards a career path. Now, it's a challenge for anybody to get into residencies these days, but over 99% of our students do. We have students going to Mayo Clinic this year. We have students going to Cleveland Clinic. We have students matching into residencies throughout the state of Texas, and they're representing a number of specialties. Our alumni have done things, aerospace medicine or sports medicine or even small town primary care, which is part of what our mission was founded. Our graduates and our alumni will do a lot of different things in a whole host of different specialties. So the opportunities are available. And there are certainly, going to TCOM, we're gonna work hard to, certainly challenge you. But as a student, and I would say this to any student going to any medical school, that you need to realize that you're the one responsible for your path on this, on your pathway and what your interests lie. To do the homework, do the extra work that you may need to do to get where you want to be, and realize that it's out there. Residency programs, people I've associated with for many years in different medical centers around the country, they always talk about how great our students have done in their programs, and I assume that they are, saying that about students at our DO school or other DO schools around the country as well. If they bring them in, they bring them in, they like that they've got, and they're excited about that, and so we're really proud of our alumni and what they've been able to accomplish, what they do to continue serving our state and serving the country and actually doing work overseas. I mean, so that's what we have to offer, an opportunity for prospective students. And I think as they look at their options, I mean, they might find that we've got the materials. You're going to learn things, an amazing amount of material in medical sciences. You're going to have a lot of opportunities to learn about clinical medicine, that part where the rubber meets the road in your patient care. We're going to teach you a lot. We feel like we do that probably more than most schools do. That we know that we can certainly provide some great chances for you to do a lot of good things.
Well, I think that leaves us on a really high note, but is there anything that you'd like to tell applicants for this next coming cycle? Any advice that you'd like to offer them?
Well, always is, and you probably hear this from more than one person on a podcast, get your application done early, stay on top of making sure things like your letters are getting in, keep your application, turn in a complete, thorough, up-to-date application, get it in there. September for the TMDSAS, the end of September is a deadline. You're better off turning it in, getting it in earlier. Our secondary deadlines in mid-October. It's better just to get it done. Gives us more chances to look at your application. We certainly are really excited about the year coming up. We have a great class this year. We had a great class again last year. So we're always excited about the class we're getting. We're looking forward to this year. We are changing our interview process this year. We are we are looking to do the MMI interviews next year. So, but don't get intimidated. For those who are listening, don't get intimidated by that. It's just for us to get know you in different ways, and we will interact with you individually, but we want to also kind of get you learn more about you and your skill set through a more formalized process.
Definitely. That's very exciting that y'all are changing over to the MMIs. We'll definitely be addressing that through the advising network on advice for applicants. So,
okay.
Well, Dr. Kennedy, thank you so much for taking the time to speak with us. You've got some really valuable information for all applicants, and we're very much looking forward to this next year and finding out how the MMIs work out for you all.
Okay.
Make sure you subscribe to our podcast on iTunes, Google Play, or wherever you listen to podcasts to stay up to date with us. Follow us on Facebook at facebook.com/TMDSAS and at Twitter at TMDSAS and at TMDSAS Support. On behalf of TMDSAS, we want to wish all our applicants for the 2018 cycle all the best of luck. Thank you very much for listening. We'll talk to you later.